I think that we need to add a bigger spotlight on the commercial determinants. In the whole field of health promotion in the 40 years that the field has existed, this is the strongest lever that we have.
Welcome, Gauden, to the Via Diabetes interview series. It's a pleasure to have you.
It's a pleasure to be invited.
When you were at the WHO, I know that you worked in positions all around the world, like China, different places in Europe, Fiji, the Philippines. I wanted to ask whether there were any cultural differences that intervene maybe in your work at all?
Yes, of course. It's very different working in, for example, the Pacific Island countries and territories versus working with Central Asian republics or working with the European Union or organizing a global conference or working with China, which is a region unto itself. I think it is part of working in global health that people have to be aware of the cultural differences and to absorb those differences and incorporate them into the work that we do. It's not just that there's a standard set of public health prescriptions, a standard set of resolutions and targets, and you go in and pass them on. In the Pacific Island countries, there is a phrase that is used, which is the Pacific way. There's a set of beliefs that people have about the importance of the community, about the importance of observing the cultural traditions, that it was much easier to work. I was recently in Ashgabat, the capital of Turkmenistan, and for non-Turkmen ears, Ashgabat might even sound like a harsh word to say with the guttural sound, and it sounds, dare I say, alien. But then learning that it means the city of love or the city built by love, suddenly it acquires completely different sheen.
I know that you led the effort to document the commercial determinants of NCDs in Europe, and you also led the team develop the quick buys for NCDs. What's the impact of this work?
They say a lot about what's the direction going forward for non-communicable disease and diabetes, both for the general population and for people who live with diabetes. In the tradition of health promotion, we have gone from simply changing behaviors and talking about risk factors for chronic diseases into thinking more and more about the determinants. That seems like semantics, but risk factors have the danger of putting the blame on the individual. Smoking as a risk factor suggests that personal choice is very important, but the language of determinants focuses much more on the issue of environments that generate behaviors. And so the price, the marketing of unhealthy commodities, their packaging, their accessibility, they are extremely important factors, more important than price, more important than personal choice. Absolutely. I think that we need to add a bigger spotlight on the commercial determinants. In the whole field of health promotion in the 40 years that the field has existed, this is the strongest lever that we have. Quick buys is a completely different agenda. The idea is simple. You go to a country, you have work done, then their new minister comes and the new minister has new policies. How do you get them convinced to be able to adopt new policies for non-communicable diseases or even to sustain the old ones, to continue to fund them? It's a very real problem because you're sometimes working against a bias that this new minister is thinking, oh, chronic diseases, the name speaks for itself. Nothing happens for the next 15 to 20 years. I'll be long gone by then. So I wanted our team to produce something rigorous with a series of systematic reviews, looking into the best buys that are the canonical list of cost-effective interventions produced by WHO and endorsed by the World Health Assembly, and to ask simply, if a minister invests significantly or a country invests significantly in the implementation of enforcement of these interventions, which one can give a measurable result between 1 and 5 years, a notional duration of the term of a minister?
I've been interviewing quite a few people in the diabetes community, and something that people living with diabetes have mainly raised is like the top 3 issues are the cost of healthcare for a lot of people around the world, the lack of access to insulin, especially currently in conflict zones, and the lack of access to mental health support around diabetes. Could you tell me a little bit about what the WHO may have done to address these points?
WHO's biggest contribution to diabetes prevention and care is in the Global Diabetes Compact, which was adopted by the World Health Assembly. I think it's very important to understand that the world has adopted highly ambitious targets for the level of diagnosis, the level of recognition of diabetes, the level of glycemic control, the level of blood pressure control, the level of statin use, and the level of accessibility and affordability of insulin. And I think there's no similar in other areas. We are doing well on the recognition of diabetes, on diagnosis. Accessibility and affordability of insulin can't be really assessed because there was not enough data. So there, even collecting the data is a political issue and needs action. So in summary, the work that we were doing was trying to get a regional shift in policies, awareness of the importance of adding data on the affordability of insulin. If you read the report, there are basically highlights on the gaps and the inequalities, the importance of stronger data, the importance of having more adaptable systems, the need to verify access to insulin, because it is often reported as all people with diabetes are eligible for support, reimbursement, or provision of insulin. But this is not verified, and therefore it is not true that there are 100% accessibility, even in Europe. They are using this data for action and engagement of people with lived experience. So I think that report serves as a rallying cry for countries that participated, and I will briefly say that within the UN high-level meeting, there was a very strong priority given to mental health and non-communicable disease within the global community and the political declaration that came out. And some would argue, including me, that of all the political declarations since 2011, mental health had its highest priority.
I know that you're a cancer survivor, and I wanted to know how that experience, how it's impacted how you view life, and also maybe your work in NCDs.
I think it is a way of bringing attention of policymakers, but also of having people cope with their own diagnosis and so on. I'm lucky to have survived, and therefore let's make the most of it. In personal life, knowing that there was a point in time when I was very close to dying gives you a different perspective. I count the number of weeks since my treatment started. I'm in week 282. I value every week.
Where do you hope to see policy around NCDs go in the next 5 years?
If we focus on any individual disease, whether it is cancer, whether it's diabetes, whether it is chronic respiratory disease, we can make a difference, but we will always be seen as people advocating for a condition that is technical in nature, not policy oriented. It's very important that we have a World Diabetes Day. Immense importance, a rallying cry every year. But when diabetes went to the UN General Assembly and asked for its resolution, it got a day. When NCDs went to the General Assembly, we got a political declaration that had a wide range of interventions, targets linking non-communicable diseases as a group with the development agenda were only possible because all the diseases came together. As we lose the prerequisites for health, as peace is dissipating, as climate change absorbs the development attention, it absorbs the policy space, the headspace that countries have. We still have targets member states have bound themselves to, committed to in 2015. 2030 is not so far away. Right champions can still make a lot of difference to push the Sustainable Development Goals through to a more hopeful showing that can drive our vision going to 2050 with greater hope.
I feel like I learned so much from you, so it's been an absolute pleasure to have you.
Such a pleasure to be talking to your community, and thank you for the invitation. It's been a very pleasant conversation. Thank you.